Many people want to know if they're a candidate for a dental implant. To be a good candidate for a dental implant, one of the big things that you need is bone. Not everybody has adequate bone for a dental implant. The implant is placed into the bone and it needs a certain amount of bone surrounding that implant if we expect the bone to accept the implant. In situations where you don't have enough bone, often there are ways to gain bone by having a procedure done by an oral surgeon or a periodontist where bone is grafted to the area. One of the common things, I would say a very common lack of bone that we see, or I should say a very common situation we deal with, is when somebody has lost bone here in their top jaw in the back and they don't have enough bone because the sinus, the pressure of their sinus over their life has put pressure and pushed down the bone right wherever the sinus is. And a very predictable procedure that our oral surgeons here at Gundersen Lutheran do is to graft bone up into the sinus area, right below the sinus membrane. We have many patients that have gone through with that procedure so that they could get dental implants back here in the top jaw. There's often bone in the front, both the top and the bottom. There's often enough bone. One of the biggest challenges is when people don't have enough bone down here because of a large nerve that runs through your jaw. We can't go near that nerve, and if you've lost enough bone, it's very difficult to get that bone back. When you don't have enough bone down here around that nerve, one of the reasons it's so challenging is because we can not predictably get vertical height to your bone. We can't get your bone to grow taller. And in those instances where people have lost bone down in here, the way that we typically handle those situations is we place the implants in the front before the nerve gets involved. And if we have enough implants here in the front, we can put a fixed denture onto those implants in the front that reaches back a little ways, kind of like a cantilever effect. You know, a couple teeth will be hanging off the back. And as long as we don't push it too far, as long as we stay within the limits that research has proven are a good mechanical success, then they do very well.